free tests, up to 10 free tests over 3 months to the most vulnerable in our community. The Premier and I, of course, have been proposing this for a number of days now, and I'm really pleased that that was a decision out of National Cabinet. I can advise that we are already seeing a reduction in lines based on the decision of National Cabinet yesterday that people who have a positive rapid antigen test at home do not need to come forward to validate that positive test with a PCR test. So again, I remind people, if you have a home test, it has come back positive, then you should assume you are positive with COVID and follow all of the advice that is readily available for you online or in many forms, or if you're not sure what to do, you can ring the 134 COVID number for advice. Don't call an ambulance, don't turn up at an emergency department simply because you have a positive test, unless you are seriously unwell and needing that treatment. And that goes for people wanting tests. We are still seeing people coming to our emergency departments who have mild symptoms but haven't been able to get a test, who are coming to our EDs for tests. Please do not overwhelm our health workers and our emergency departments if you are not needing emergency care. Please stay home if you're unwell and try to get access to either a rapid antigen test or a PCR test, or, as the Chief Health Officer said yesterday, assume you have COVID and stay at home and follow the advice on that. I can advise that we have 10,332 new cases in Queensland. That puts us at 42,250 active cases. Sadly, I do want to report that a gentleman in his 80s who passed away on the 27th of December in Queensland has now been confirmed as a death relating to COVID and will be counted in our numbers. I want to pass on our condolences to the family and friends of this individual. I know they've waited for some time for formal confirmation. The Chief Health Officer has spoken to the family over the last couple of days. So please, we are very saddened by this news, and any loss of life, of course, is very sad, especially for those most close to those individuals. Testing, we saw 34,832 samples taken over the last 24 hours, and we now have 12 people in ICU. 2 of those are ventilated, and we have 284 COVID-positive patients in hospital, in addition to those in ICU. We have many thousands, over 19,000 people being cared for under our care in home model as well. Our vaccination rates are now at 90.85% first dose and 87.03% second dose. And I can advise that we have seen new cases in the local government areas of Wujal, Hope Vale, Mornington Island, which I flagged yesterday that we had had some news overnight, Mornington Island, and Barcaldine. So once again, we are seeing the majority of Queensland showing up positive cases, and I don't think it will be long before we'll see all 77 local government areas of Queensland reporting positive cases. So please follow the advice that we are giving around keeping yourself safe, isolating or quarantining if you're positive or you do have symptoms, so that you're not spreading this through the community. I also welcome the decisions overnight around the rolling testing of freight drivers. This will help with ensuring that we're getting stock distributed around the country as quickly as possible. Other changes to testing requirements, including testing will not be required before patients present to hospitals. In Queensland, we had already given this direction to our public hospitals a number of days ago, but this is across the country. So we hope that the private hospitals also implement this as quickly as possible and ensure that people are not turned away from getting treatment because they haven't been tested first. And in relation to schools, we welcome the agreement to continue to consult. We are working up proposals that will go back to the Commonwealth at the end of this week, and we hope to have a national return to school framework decided very quickly. So I know parents are anxious to know what that is, and the states will be moving as quickly as possible and working with the Commonwealth so that we can get this framework decided and announced before the start of the school year. The other thing I note that it was noted by the Prime Minister yesterday that Queensland is not changing our rules in relation to testing of international arrivals once they get here until we hit the 90% double dose. But what I can say we are doing immediately is international arrivals who are quarantining at home, who have been required to attend and get a PCR test, they will be able to get their test as a rapid antigen test instead, so that we can reduce those lines that we are seeing at our testing clinics across the state. So I remind people, the only people coming forward to get tested right now at our clinics should be people who have symptoms, who have not been able to get access to a rapid antigen test, or people who are requiring a day 6 test who are a household close contact who again has not been able to get access to a rapid antigen test. All other people should be staying away from these lines at the current time so that we can ensure that those who most need these tests are getting these tests as quickly as possible. I'll now hand over to the Chief Health Officer. Thank you.
So today we have 10,332 confirmed cases of COVID-19 in Queensland over the last 24 hours. Of course, we know this is a gross underestimate of the true number, because as we know, some patients... sorry there. As we know, many patients are doing their own testing, their own RAT testing at home. Some patients will have very mild illness and won't even recognise they have COVID-19, and some patients won't be able to access testing, unfortunately, as we all know. Queensland now has 42,250 confirmed cases of COVID-19, including the LGAs of Hopevale, Mornington Island, Barcaldine and Wudjil. There are just 12 patients in the intensive care unit and still just the 2 ventilated patients, interestingly, and that's some cause for hope, cautiously, that we are not seeing a very major escalation in intensive care admissions yet, which we would have expected, say, previously, had this been an epidemic last year prior to vaccination or with the Delta strain. We know that at least 80% of the virus we're seeing in Queensland is Omicron. The number of patients in hospital, that is in the hospital wards with COVID-19, is increasing steadily, up to 284 cases in the hospital wards requiring treatment for COVID-19. Now, this is the intermediate level of patient, not the patient requiring the high-level intensive care support, but patients, for example, who might need some oxygen for a few days, and that number is increasing and is expected in the next 2 to 3 weeks to increase very substantially. And hospitals are now preparing for a substantial increase in the number of ward-type patients in the coming weeks. This epidemic is looking quite a bit different from the previous epidemic, where we saw a lot of patients in intensive care, mostly overseas and interstate. Now we're probably going to see more ward-type patients. Again, just to emphasise, the vast majority of people will have mild illness, very mild illness. And by now, most of us know at least one person who has had mild COVID-19. But the sheer number of patients that is going to get infected in Queensland over the next few weeks means that even a small proportion of this very, very large number will end up in hospital. And we're now becoming increasingly aware, both here in Queensland and interstate, that a lot of these patients will require ward-level treatment hopefully for a relatively short period, but they will require things like oxygen and the like. Sadly, we have a COVID death to report today. This is of a man in his early 80s who actually died on December the 27th. This man had been treated in hospital for other conditions, and we were waiting for a coroner's report to confirm that the cause of his death was in fact COVID-19. This also reminds us, and this is important, that the bulk of the patients, the many thousands of patients that we have been seeing so far in this pandemic in Australia and Queensland have been young people, mostly in their 20s and early 30s, because this is the most socially mobile group. And so we've seen major outbreaks in that group, and this is the fittest, healthiest group in our adult population. So we are just beginning to learn about the effect of the virus on the older age group. We still have not seen significant numbers of serious illness in the older age group, but the numbers actually infected still relatively small. And so that will be important to observe over the next 2 to 3 weeks, what happens in the older age group as more get infected. And that is why it's particularly important that this age group get that third dose of vaccine. That's very critical. The more vulnerable and anyone over the age of 50 or 60. There are 19,299 patients receiving care at home. As of the 4th of January, vaccine coverage was 90.85% first dose for those over the age of 16 and 87.03% of second dose for those over the age of 16. As you've heard, the rat tests are slowly being distributed to the major centres in Queensland. This will take a while. There are, of course, major shortages nationally and worldwide. At this stage, the rat tests are specifically targeted at those requiring their day 6 test for household contacts. So the household contacts requiring their day 6 test to be released, and also for symptomatic people who can't access a PCR in any other way. But it's important again to acknowledge the change requirement from National Cabinet that those people who have a positive rat test no longer require a confirmatory PCR test. I'll now hand back to the Minister.
Just while you're there, I hope you don't think this is a stupid question, but are you, as a medical professional, happy that this spread that we're seeing in Queensland is Omicron and not Delta? It would seem that from what we've learnt from Delta, the repercussions were far more severe, whereas Omicron, you're saying, is most healthy people is a 3-day turnaround. Is that safe to say?
Yes, of course it is. Yes, it is safe to say. I mean, there are 2 reasons, I believe, why we are seeing very few admissions to intensive care so far. One, first and foremost, is vaccination. We have very high vaccination rates in Queensland. And also, to a lesser extent, the Omicron strain is clearly milder in severity. Unlike the other states, we have not had a significant Delta outbreak in Queensland, and many of the admissions to intensive care interstate have been the Delta strain, but we still are seeing, they are still seeing mostly interstate. I'm still hearing reports of critically ill people with the Omicron strain of the virus. The other thing with the Omicron strain, for the good and the bad, the fact that it's very infectious means we're going to see a very large number of people in the next 2 to 3 weeks getting infected and also impacting on our hospitals. That's bad in one sense, but also means that the peak it is likely to end sooner. As speaking as someone who's worked in hospitals, and I'm talking to my colleagues here, I think we are very good at stepping up to an emergency, which is what we are about to see. So to all of my colleagues, we're going to be stepping up to a very major emergency in the coming 2 to 3 weeks. When that emergency drags on for a long time, that is much more draining to deal with. So there are there's an upside and a downside to this.
With an emergency, there are so many things that people at home can do to help relieve the stress on emergency services like bushfire plans, flood warning. What you're saying to people now to help with the emergency in Queensland would be if you are fit and healthy and you're sick, just stay at home, and that would go a long way to help emergency services. Is that what you're saying?
Thank you very much. That's exactly what I'm saying, and I will repeat that again, particularly to those people who are fit and healthy and who have any illness that looks like COVID-19, even if they cannot confirm it with a RAT test or PCR, sore throat, headache, fever, runny nose, cough, please do not come to the emergency department. The biggest problems we're having in the hospitals at the moment is relatively well people turning up to the emergency department and causing problems there. And I understand why. I understand that they're having difficulty getting the test. So I sympathise. But for the vast majority of young, healthy people who aren't in any way immunocompromised, this is, for the most part, a mild illness. And I would suggest that only seek medical advice or go to a hospital or dial 000 if you become breathless, have significant chest pain, or are getting significant dizziness or fainting. Or perhaps if your illness is lasting more with fevers for more than 2 or we'll say 3 days. Most people start to improve within 2 or 3 days. If it goes beyond that, I would start getting medical advice. But if it's just a short-lived illness, particularly if you're young and fit and healthy, you should be able to manage at home with Panadol and fluids and just looking after yourself and making sure that you keep in contact with friends and family who can make sure that you're okay.
Well, so when you say you're preparing like ward type treatment that to increase, what do you mean by that? Like, how do you, carry out infection control in the hospitals?
It's not so much about infection control, it's more about preparing, we will reallocate staff, like medical staff who might currently be doing jobs, for example, in elective surgery. I don't want to talk about elective surgery today, but there may well be that young doctors who might be working in surgical wards will be reallocated to work in COVID wards. That's the sort of thing we're talking about, and there may be some reallocation of ward purposing there will be reallocation of ward purposing in the coming weeks.
You haven't made a decision about elective surgery at this point?
At the moment, individual health services will slowly be pulling back on elective surgery, and people will already be aware of that. But there'll be more. We'll be learning more about that in the coming days. That's inevitable. I mean, I think we've all expected that.
How many hospitalisations are you expecting at that peak? Is any modelling being done on that?
I think it's fair to say the number will be in the thousands in Queensland.
Tens of thousands?
No, thousands.
Do you have any more information about the other gentleman who died on the Gold Coast earlier in the week?
No, so it's before the coroner.
Minister, just to relay what the doctor has just said, I guess you'd be calling on, it's a pretty stark warning from the doctor. He doesn't hold back, which is good, but there is an emergency coming, and I guess your message to people in Queensland is that we can help, alleviate the stress on our system.
And certainly, I don't think I covered it before, we did say over the last few days that we'd be getting our rapid antigen tests into some of our testing sites. There will be 150,000 tests, but there's 39,000 kits. So they come in kits of 4 that will be made available today. Now, I'm not going to say from today, because I expect that 39,000 will probably run out in a matter of hours, if not a couple of days. And we will then have to wait for the next supply to arrive. So we are going to see inconsistency of the availability of these tests that we can hand out at our testing clinics, and I ask for people's patience. Because I know that there'll be frustration when they see people getting it and then they will run out. But we've chosen our longest waiting lines across southeast Queensland, and at those sites today, some people will see we will be handing them out to day 6 and also to the most vulnerable that are needing it. So obviously if there's heavily pregnant women standing in that line, very elderly people who have symptoms, who are unwell, we want to give them a test if they want to take a home test so they can go home and rest and look after themselves and do that test in the comfort of their own home and not wait for long periods of time doing the PCR test. So we look forward to getting more of these tests, but we have only been given just over 150,000 at this point in time. So again, I ask people's patience, but we do have all this information online. How to prepare, how to be COVID ready. Just like getting, storm ready, we want you to be COVID ready. So if you haven't gone online yet and looked at what you can be doing to equipping yourself at home, with Panadol, with tissues, with just making sure you've got adequate food for a week if you need to quarantine. But that doesn't mean you need to go and buy up stock of food for weeks and months on end. Let's be sensible. We've seen those problems before and our shelves emptying out. We don't need to see any of that. It's 7 days, and we know that people can do contactless delivery now with groceries as well, or you may be able to get a friend or family member or neighbour who can go grocery shopping for you and just leave it at your front door. So there's many, many things you can do to stay home, keep yourself safe, and also your friends and family. And no need to turn up at an ED or for a PCR test if you can get one of these other tests, or just wait for a couple of days.
Minister, I know we're shifting away from focusing on case numbers, but with people using rapid tests, how are you planning to track the progress of the pandemic?
So our team is working on this right now. We do still want to know that someone's positive, but that shouldn't have to be coming and getting a PCR test, lining up for hours and waiting days for a result. So we're working on a system at the moment so that we hope people will be able to notify us very easily that they have got a positive rapid antigen test. So we can get them into a system where we know numbers that will help us model and understand the growth of the virus in the community and the likely hospitalisation rate, but also if people really are vulnerable and need assistance, that we can still help them and know that they're out there in the community at home with COVID. So we're working on this. I raised this, this was a discussion with health ministers yesterday morning. I know they're looking at this at a national level. I would like to see a national system set up.
Great idea, Minister. What about like QR codes?
Well, I think a QR code, you just want to be the one who leads the way, Peter, I know. But I don't want to take away your thunder there, Peter, but I did discuss QR codes this morning with the Premier. Sorry. Look, we are looking at all options. Whatever's going to be quickest and easiest, that people can get their information into a system so that we know that they're positive, that we know the number of positive cases in Queensland and Australia, I think is really important. We don't want to take our eye off the ball as far as having an idea of the volume of the virus spreading through the community. Globally, they're still tracking numbers, and we need to find a way to manage this. But right now, we need to create a better breathing space on our testing clinics, on our pathologists, and prioritise who really needs those PCR tests.
Minister, on ambulance waiting times, dozens of Queenslanders waited 10 hours or more for an ambulance to be dispatched, and that was before this wave of Omicron. How comfortable are you with those wait times, and what are you doing to tackle it, especially given there's going to be, there's already pressure?
And I assume those that information's come from the question on notice that I've provided and tabled in Parliament.
Yes.
And so, what those times actually show is we are seeing a reduction. We're seeing an improvement. It's not where we want it to be right now, and in the current environment, I suspect the next lot of data we put out will show that time's gone up again, because we've got people calling for ambulances that when the paramedics are getting there, they don't need to be transported to home. But that still takes time for that paramedic, for those ambulance officers to drive to someone's home, to check on them and to give them advice, to triage them and give them advice that they can stay home and care for themselves or their loved ones. So I think we're going to take another hit on our ambulance numbers, and that is why the messaging we are giving every single day is so critical. This is in your hands. You can help us take the pressure off our ambulance system to make sure that those ambulances are getting to those people who most need them as quickly as possible.
Can I please ask you to clarify the numbers of the tests? So if you've got 150,000 today, is there
Yeah, so
more coming or you don't know?
yeah, so we had planned, and earlier in the week I think I said, we were expecting 500,000 tests in the next few days. Unfortunately, the distributor has said that they're only releasing the 150,000 to us at the moment. They are trying to source more. They're hoping they'll get more to us over coming days, early next week, but I'm not going to give a guarantee that that's going to happen when they've only released just over 150,000 to us at the current time. We do have, as the Premier has said, millions on order, but so does every other state and territory, so does the Commonwealth. The Commonwealth and the announcement yesterday around the free tests being given to people who are on concession cards and health cards and so forth, the Commonwealth has said within about 2 weeks. But even that, that's pretty fluid. We're back to where we were in February, March last year when we were talking about vaccine arrivals. We're hoping they arrive on shore, on time, in the numbers we need, but until they get here, we can't be absolutely sure.
Minister, just to simplify things, so moving forward from today, we can report to the public that if you fail a rapid antigen, or if you test positive to a rapid antigen test, your directive now is to go home. Don't go and get a PCR test, just head straight to your home and isolate. That's what we can tell the public.
If you have a rapid antigen test that has come up positive, you do not need to go anywhere else to validate that positive result. You should assume you're positive.
And now that you're working on that system, can people notify Queensland Health now that they've tested positive if they want to do the right thing?
They certainly can notify us. We're certainly not going to criticise anyone for letting us know that they're positive and making sure that they're in the system, and especially if they have any underlying health conditions where we may need to assess whether they need to be monitored as part of our care in the home program. So they can contact us, but I'm asking people, if you are perfectly well and you've got a positive result, don't race to get on the phones and flood our 134 COVID number. We don't want thousands of people ringing up if they're feeling reasonably well at the moment. Just give us a little bit of time while we work out this system, and hopefully people will be able to get on a system and let us know. But if you're unwell, you're concerned, you want to let us know you're positive, and you've got your positive result for that test, you can certainly give us a call and let us know.
Doing day 5 testing getting to state arrivals, and is that going to change any time soon for the rapid antigen testing requirements?
They don't do day 5. What they do is they have to test on arrival, and they have to test on day 12 at the moment.
Right. There's not going to be any
international.
There's not going to be any changes to that, though.
There's not any changes to the timing at this stage. We're taking advice on that, but as the Premier said with agreement with the National Cabinet yesterday, Queensland will still require those tests until we hit the 90% double dose. But we are immediately allowing those people to do a RAT test as opposed to a PCR test, which will, again, the figures I've got today is there's 2,742 people home quarantining who are international arrivals right now.
Minister, just at testing sites, traffic controllers, testing staff have told us they've been spat on, abused, shoved. What's your message to people carrying on like that?
Well, if you are spitting on someone you think you have COVID, it could be an offence. And you could be fined, and it could be a criminal offence. So, let alone you could be fined or charged, don't do it. It's disgusting, it's offensive, it's disrespectful, and you're doing it to the people who are there turning up every day to help you. That's all their job is to turn up every day at those testing centres to make sure you get the test you want and get your result. So to abuse them, there's just no reason to do that. They are trying to help. Please show respect. We know people are anxious, we know they're frustrated, and we hope that the changes that we've been announcing over the last couple of days, and particularly what's come out overnight, we do hope this will ease some of those pressures and those waiting times. And I have already heard this morning that some of these lines are significantly down from previous days.
Minister, just one more in relation to school returning. Some GPs are saying that they won't vax kids because they don't have enough resources. Parents are saying they're having trouble getting a booking in the next 2 weeks. Are you concerned about schools returning back? Should parents be concerned? And what are you expecting to happen with kids that maybe aren't vaccinated?
So I know our message has been go to a GP or a pharmacy and certainly book in to get your child vaccinated. They'll be eligible from the 10th of January. We will have our vaccination centres open as well, and our vaccination centres are walk-ins, so you can book as well. But our vaccination centres are walk-ins. We want parents who want to get their children vaccinated to get vaccinated as quickly as possible. And we will be working on ideas of how we can, again, support families in getting those vaccinations done. The statistics we've seen now with the 12 plus is incredible. We've got only about a 1% difference between our 16 plus that are fully vaccinated and our 12 plus. There is only a 1% difference, remembering they started so much later. What that says to me is there are parents wanting to get their children vaccinated. I suspect the 5 to 11s will be the same, and I encourage, jump on our website, have a look at where our state vaccination centres are and where you can walk in, but also keep checking, because I am aware that there are pharmacies that have availability. So please keep checking with your local pharmacies as well if you can't get into your GP. But we hope that GPs will be doing these vaccinations as well, because we all need to do our part to make sure that we can get these young people vaccinated as quickly as possible.
On the rats, the rapid test again, so can you just explain how they're being distributed? I thought the other day it was understood that the government said there were 500,000 rats that you'd taken delivery of.
So there was 500,000 that I was advised on Tuesday would be able to be leaving the distributor within the next couple of days. Instead, what was released to us was 150,000. So we have been working with this company about extra supply, but once again they have confirmed overnight that that is the only supply they've got available for us right now. And we will keep working with them to see if we can get the remainder of the 500,000 that we were told would be available to us, see if we can get that over the next few days. But of course we've got that much larger supply that we're expecting as well. They're all coming from overseas, many of them, yeah. No, I'm not aware of the source from that particular company.
Just one last one's come through from the Gold Coast. Are you concerned about the Gold Coast University hospital admissions at the moment, that they are starting to fill up?
They are certainly increasing, but again, every day I am asking the question of how, not just how each hospital and health service is managing, but also how each of our hospitals are managing. They will make decisions on the ground whether they need to shift their resources, their staffing, and I know the Chief Health Officer is very keen to talk to all of our hospitals and our chief executives as well, to make sure that every doctor, every nurse, every physician, every clinical specialist, health worker out there understands that they are all COVID health workers now. Doesn't matter what your specialty or your area of work is, we all need every one of our health workers to be pitching in to support managing these COVID patients, no matter where they work in our hospitals, and that's what we're working through.
You didn't have any money riding on the Joker to win the Oz Open, did you?
No.
The doctor, did you back the Joker? No?
Just one more. Do you think there should be a statue of the Queen? Gerrard is calling the one to be commissioned.
We've had 10,000 positive cases overnight. I think my priority is keeping people safe and trying to make sure that we have the least loss of life for COVID as possible. If Gerrard sees that as his priority, that's up to him. Thanks.
Can I just ask you one question on the schools returning, Dr. Gerrard, sorry. Are you expecting that they will, you know, if there are kids that aren't vaccinated, are you expecting to see mass cases? Will they effectively turn to super spreaders?
Are we expecting to see mass cases among children? There could well be. Remember that this illness in children is mild usually. It's quite possible that significant numbers of children will get infected, but in children the illness still is mild in the vast majority of cases. So yes, possible, but I wouldn't be. If I were a parent, I would not be unduly concerned. I'd be getting my child vaccinated, but I wouldn't be unduly concerned about it.
Do you think obviously there's still a national plan that has to be worked out in terms of schools, but do you think that we're looking at things like mask wearing or rats?
No, I don't want to speculate on that. I think that's a national plan.
Thank you.
Thank you very much. Thank you.
Thanks, Drew. Come on, you were back to the Joker, surely.